Hello, hello, and welcome to our new episode of the Wonder Tooth podcast. Today, we are going to talk about dental veneers, and I'm going to guide you in a step-by-step how we prepare for dental veneers, the difference between a dental veneer and a dental crown, and also how we put them in the mouth. And how am I going to do that? I'm going to show you a video. One of our patients, and you're going to see exactly how it's done, how it's actually minimal preparation, and how they look like the before and after, which is very intriguing. A lot of the patients, they have that wrong idea that in order to place a dental veneer, you have to shave the tooth a lot, which is not correct. Remember, in my previous episodes, I said dental veneer is very different than a dental crown. The crown, you have to shave the tooth 360 degrees, while dental veneers, you literally just go like 180 degrees, and it's a very minimal preparation, like 0.1, sometimes to 0.3 millimeter of the enamel, which still stays in the protective layer of the enamel. And that's why the teeth should not be becoming too sensitive. A little bit of sensitivity is expected, but nothing too crazy sensitive. Not even a root canal sensitive, that's for sure, if you know what you're doing. And that's very important to know, because if you decide to do any cosmetic dentistry, you really have to select the dentist. You have to understand that, yes, dentists are trained to do dental work, but not everybody is trained to do cosmetic dental work. So I hope this would be a fun episode to watch, because this is literally one of our cases, and I'm gonna show you step by step what we are doing and how we are putting them, and even the material that we're using to make it happen, and how long it takes to put the veneers in the mouth. And at the end, what are basically the precautions that we should be doing. I hope everybody's okay, and I hope that you're going to enjoy this nice episode today, step by step dental veneers. So right now, I'm going to start to share my screen to show you the video. So basically, right now, we already prepared the teeth, and you're going to be able to see the difference between the tooth that is shaved to a dental veneer versus a tooth that's shaved for a dental crown. So in this particular scenario here, I'm going to start to show you this. So basically, the teeth are already prepped. So the front teeth, you can see all those front teeth here are all they look exactly the same. There is one tooth on the side. Basically, if you are looking in the mirror, it's going to be on your left side, but here it's going to be the right side. It looks a little smaller, and that tooth is prepared for a crown. And why is that? Because that tooth had a root canal treatment. So root canal, I'd rather put a permanent crown rather than a permanent a veneer, because we need to have the tooth secured. Once there is a root canal done, the tooth basically, it loses all the strength, the nutrition, so it becomes fragile. So right now, the blue thing, this is the etch. And what is the etch? Is phosphoric acid, is 37% phosphoric acid. And you can see right here how that tooth, it looks a little smaller. That's the one is prepared for a crown. While the other teeth, you can see they look pretty much like natural teeth. The phosphoric acid, this is basically to create tiny micro retention in the surface of the teeth. Why do we need that? Because, if you are a handyman, or if you know a little bit about like even sandblasting or stuff like that, you need to create some rough surface, a little porous surface for the material, for the glue or the cement, the bonding, to basically bond between the natural surface of the tooth, which basically is going to flow within those tiny tiny micro pores, and also the fitting surface of that veneer. So right now, we usually put the acid for like 20 seconds, 15 to 20 seconds. And this is basically to create that tiny micro pores in the outer surface of the tooth. And right now we are cleaning this. We are using the suction to clean, all the acid, because you don't want too much acid there, obviously. It can burn the gums also. So you have to be very careful with this. And right now, what I am putting right now is the bond. So that bond is the very thin layer that's going to flow in those tiny little pores that were created by the acid, and that specific bond is going to bond to the fitting surface of those veneers. So right now we are bonding the outer surface of the teeth. Can you see that? And it's a very meticulous job, and that's why things have to be completely dry. And that's why we have that we call obtrugate, which basically like to retract the cheeks, and to keep it simple. And we don't want any saliva. A lot of patients, they're like, my mouth is very dry. Oh my God. I said, I understand that has to be dry because it can really affect the integrity of the restoration, whether we're putting a crown or a filling, even white fillings, everything has to be completely dry. So now you understand that. And that tiny tooth, you can see that I'm going all around the tooth because that's a crown. So the outer surface of the tooth, 360 degrees, while the rest of the teeth, just the outer surface of the teeth, and sometimes also the little edge. But you can see they're very minimally prepared, very, very, very tiny preparation. Veneers are very conservative compared to crowns. You can literally see that here right now. So once we apply that first layer of bond, we have to kind of blow slight air because you don't want it too thick. And why is that? Because if it's too thick and it sits around the margin of the veneer or of the tooth, then it can actually affect the seating of the crown or of the veneer. And right now, what I'm using now, this is the ultraviolet light. And it's very important because sometimes some patient would come and say, I'm flossing, something is sticky there. And this is basically because, believe it or not, a very thin layer of the bonding can sit on the margin. So it prevents the crown to sit completely, totally where it's supposed to. That's why we have to dry it like very lightly and quickly, because also you don't want this to sit too much, in the light where we use very strong light, because you want that ultraviolet curing light to cure that and to make it clean. Right now, this is the situation, and the teeth are very minimally prepared. The tiny one that's prepared for a crown. And why is that? Because that tooth has a root canal. You can actually see the color of that tooth is different than the rest, because once the teeth have a root canal done, sometimes they, as I said, they lose the nutrition. So also there is no vitality, there is no blood supply. So the tooth itself starts to become darker. And that's one of the main reasons why we are doing this here, to put a crown rather than a veneer, because it becomes very fragile. Right now, what I'm doing now is I'm preparing the veneers themselves. So the veneers and the crowns, right now we prepared the teeth. The teeth now, the natural teeth are ready for the veneers to be seated. However, the veneers themselves, the inside surface, or we call it the fitting surface of the veneers and the crowns, have to be treated as well. And how do we do that? We treat them as well. We do some sort of a special acid. We etch the inside, so they create also those tiny little micro pores. And then we put silane to clean, get rid of the extra acid after we wash them. And then we put bonding. And right now I am applying the cement, the glue, inside that fitting surface. And now we are gluing them on the teeth. And I usually like to start with the two front teeth rather than the side. And why is that? Because I have to make sure that the midline is perfectly aligned, and the rest of the teeth will follow that. And right now I'm just cleaning all the extra bond. Oh, not I said before, the veneers are very, very minimally invasive restorations. They're not like crowns. And you can see here the crown on the other side. Right now, I'm still putting the veneer on this side. And the cement that we are using, it's not just a regular cement. This is the really high-end cement. And they have different shades, believe it or not. So some of them are clear, transparent. This one is white because the patient wanted like something really white. And sometimes if I have a really dark tooth, if I put transparent, it's going to show through it. And if I put white, the color can still show through it. So I use opaque to kind of mask the color. And why is the tooth dark? Because, you know, if the tooth was root canal treated just like that tooth on the side. So in that particular one, I'm using opaque to mask the color. And you can see how the color of that opaque looks different than the other glue. It looks more whitish, like chalky white. And this is just to mask the color of the tooth. And why is that? Because these are porcelain, they're very thin, and the beauty of them, the light can show through them. And that's what makes them really unique. And that's what makes them very pretty and very natural looking. So right now we started by cementing the two front veneers, number one, to make sure that the midline is on. Then we started to go with the little veneer on the side and then the crown. And I used a different kind of cement with the crown because the tooth was discolored a little bit. Right now, I am going now to cement the canine, the veneer on the canine. And it's also like a little, yeah, you can see now what's going on here. I'm cleaning one by one, very minimally invasive. Okay. And one by one, I'm trying to cement and light cure to make sure it's completely seated. Now, the canine is a little different because it kind of covers maybe the 1/3 of the back of the inside of the tooth. And why is that? Because this is the strongest tooth in the mouth. And we need to have stability. Okay. So if it's only covering just the front part and not wrapped around the edge of the tooth, it can pop very easily because there is a lot of forces coming on it. And right now we're putting the other one, so you can see I'm cleaning the inside, I'm cleaning the outside, and we're gonna cure the outside just a tiny little bit, and the inside because it wraps around 1/3 to 1/2 of the inside of the tooth, because we need what we call canine guidance. If you guys go and look at yourself in the mirror, and this is actually a very fun thing to do. Try to bite on your back teeth and try to slide your teeth side to side. And your canine should be the last teeth to be touching. This is called canine guidance because they are supposed to protect the rest of your teeth. If they're not, then you have what we call a group function. We don't want that because this is when a lot of problems start to happen, a lot of attrition, the teeth become shorter, and then a lot of wear, and then a lot of sensitivity. And now we are gluing the premolar, which is basically the last tooth here that we are putting the veneer, but that's actually a crown over the implant right there. Yep. Because the tooth looks a little different. So this is a crown over the implant. And we're just making sure we're trying to clean every one by one diligently, meticulously, because cleaning after that becomes a big nightmare. So the easiest thing to do it is to clean one at a time, or sometimes if I have like a couple of my assistant with me, we can just do this very quickly and a lot faster. But this is, we're trying to do this really to show in the video here to show you like a step-by-step and how we do it. So right now the veneers and the crowns are in the mouth, and now we're just going very gently with the light to cure them. Remember, that light is supposed to be curing for 20 seconds. So every single tooth has at this point 3 surfaces: the outside, the inside, and then the biting surface. So right now I'm just going quickly. So basically, as I said, we have to cure each tooth, each veneer, each crown on 3 surfaces: the outside for 20 seconds, the inside for another 20 seconds, and then the biting surface for another 20 seconds. This is to make sure it's completely secure. Then after we place those veneers, we need to put also like a very thin layer of a material that's basically like glycerin. And why is that? Because we don't want any oxygen to go in that layer, and that can cause a lot of sensitivity. So we should apply that material like towards the end, not after we completely seat the veneers, but like, you know, that quick light cure that I was doing. After this, we apply that material around the edges, all around the margins, and then we go with a little tiny micro brush, and we just kind of go over it, and then we cure again. And that basically seals everything and makes sure that we're going to have pretty much no sensitivity, minimal sensitivity. If you don't, then we have tiny little micro gaps that first can cause sensitivity, that because the dentinal tubules are not completely sealed. So this has to seal the dentinal tubules. And what are the dental tubules? It's basically tiny little branches that are coming out of the nerve. It's not the nerve, but tiny little branches. And we need to make sure these are completely sealed. After this is done, what we do, we go with the floss and we start to floss between each single tooth or each veneer to make sure there is no glue left. And me personally, I like to go with a very tiny, like a tiny drill, very tiny, and just go around the margins to make sure there is nothing rough left, there is nothing sharp left, and everything is nice and smooth. And sometimes even between the teeth, we go very gently to make sure there is nothing left. And after that, the patient will start to look at the, at the mirror. And then if we need to do any adjustment, I usually like to leave the adjustment for the following appointment, like a post-operative appointment. But after we do that, we check the bite. And how do we do this? We ask the patient first to bite at the back teeth and start to bite, tap, 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 like this. And the blue, the colored paper that we use, it shows actually if there are like high spots. So we can go and adjust those tiny high spots. So basically when you're biting down, it's even everywhere. And the teeth, they have a certain area where they're supposed to be biting on it, on each other, opposing each other. So once we adjust that, we start to check side to side. Remember when I said that you have to, if you look in the mirror and you bite on your back teeth, and then you slide slide your lower jaw like this, literally like this. So if you look at my teeth here, you see the canine and the canine are the last two teeth to touch. You see that? So this is called canine guidance. And why is that? Because you want the tip of your canines to hit each other when you are sliding, because that's going to protect the rest of your teeth. And why is that? Because your canine has the longest root. We call it the corner of the mouth, has the longest root. It's a very, very strong tooth. So you want this to be there when you are chewing. If the canine, if you start to lose some of the length of the canine, then when you are biting or chewing side to side, then when you do this, all the teeth in the back, they're gonna start to wear. And when that happens, then we get into a bigger problem, because now the height of the teeth, the canine was touching at the end and basically protecting them, but right now they're all now hitting each other. And that can start to cause more attrition, very severe wear on the surface of the tooth. And then if you have acid reflux, or you grind your teeth, or you eat a lot of oranges and lemon, and you're not brushing or using water after, or drinking coffee or anything that has acid, then the teeth, they start to get really flat. And if that happens, then the teeth, the relationship now between your top jaw and your lower jaw, instead of being like this, it becomes like this. And then you start to see like your face is like shrinking. And then the teeth in the back, they start to cave in. The lower part of your jaw start to cave in. And you come and you're like, I don't know what happened, but my face is starting to look, different. And that's unfortunately because of years and years of grinding and attrition, and the back teeth, they're starting to cave in. So in a situation like this, depending really on how bad the attrition is, sometimes we can fix it with, a little filling here or there, sometimes one crown. Sometimes if they are completely short, like rather than being that high, they become like this. You lost like 2 or 3 millimeters of your tooth. This is what we call a full mouth rehabilitation. Now we have to build your teeth back into the proper position and into the proper length. And why is this important? Because imagine you are biting now on your natural, on the height, the proper, relationship between top and lower jaw. If you are over biting, what you start to do, you start to push your lower jaw more forward to compensate for that lost 2 or 3 millimeters lost from each tooth. So that's probably like 4 or 5 millimeters in total. So you tend to move your lower jaw more forward, and then you start to see changes in your lower jaw, changes in your face. Then you start to get pain in your ears, then your muscles, headaches, and a lot of problems. But we are here today just to talk about how the veneers are being placed, and how it's a very minimal reduction compared to a crown. You saw what the crown looks like, you saw what the veneer looks like, and you saw how this is very minimal. And it's basically, even if the veneer pops, you look at yourself and it's like the end of the world. If a crown pops, then we have a problem. Or if a crown cracks or you bite into something hard, then, and it's a front tooth, then you'll see, because the tooth is going to look a lot smaller. Now, let's talk about the precautions. If I am putting those veneers in the mouth and the patient goes away, we have to bring the patient back in a couple of weeks to do a post-operative to make sure everything is comfortable, everything is okay. And then we have to get them a night guard. And why is a night guard very important? I really like the one, especially for veneers, that's a little bit softer on the inside and hard on the inside. If you grind, then I don't really mind if you have it all like hard night guard, and then in the back here to be completely tight in the back and kind of light grabbing in the front, because we don't want them to basically grab on those veneers and pull them. But usually also a night guard is different than a sports guard. And why is that? Because the veneer, it's a small, tiny, thin layer of porcelain, as I said, and basically the night guard should be covering only 2 to 3 millimeters of that tooth, not like the whole, just the tooth, just the tip, just the little tip of the tooth, just a tiny 2 to 3 millimeter. That's it, just to prevent it from, to prevent the veneers from being pulled. Okay. Now, a lot of big restrictions also are associated with veneers in general, which are: you're not going to bite on anything hard or crunchy. Nuts is a big no-no. Almonds, specifically almonds, they crack natural teeth. So imagine what they're going to do with the veneer. So if you really like your nuts, get the chopped ones. I tell everybody, get the chopped, sliced almonds, chopped nuts, whatever. But please be very diligent about these, because these are a big investment. Chewing gum, it's a complete no, no, no. Okay, they pull everything. They will come to me and be like, I don't know, but this is coming, because they're very sticky and they start to pull on things. Toffee, anything too sticky, you shouldn't even do it with your natural teeth, not even with the veneers at this point, or even crowns. You have to be very, very careful. And like carrots, apples, I wouldn't really bite on them. I would cut them in small pieces and chew in the back. Okay, so today we learned really few things, important things, that the canine guidance really is very important to protect your teeth in the back. And this is for people, actually, if you don't know, you can look in the mirror and you can see starting, craze lines, very thin crack lines on your canines. And that means that you're grinding side to side, and maybe it's time to go see your dentist. And of course, you should see your dentist every 6 months. And the precautions, of course, if anything happens, you have to go and check with your dentist right away. I hope this was a little bit informative for people who don't know really the difference between a veneer and a crown, dental veneer versus a dental crown, versus the shark teeth that I posted them at one point, because really the veneer has to be, as I said, it's just the outer surface of the tooth, 0.1 to 0.3 millimeter. That's really the thickness of the veneer, and that's what we kind of shave down from the tooth. And why do we shave it a tiny little bit? Because you don't want it to be too thick and bulky. Otherwise, it's going to cause a lot of gum problems. So it has to be kind of very, very thin. And basically, when it's seated on the margin, it has to be flushed. I go with my tiny little instrument, and it shouldn't be sticky. It should be very nice and smooth. Okay, guys? The crown is a little different, because the crown, we are shaving the tooth 360. But the same thing, also the margin has to be completely nice and smooth. And now we learned that the bonding, when we put it, we have to kind of blow slight air so it's completely seated. So the crown or the veneer is completely seated, and that we have to floss. Now, one last thing, when you guys are flossing, make sure with veneers, make sure you put the floss in and you pull it through. Don't pull it down. Why? Because you still don't want it to kind of disrupt something where it's not supposed to. So you make sure you put it in, you floss, and you pull it through. Okay, and then you rinse it off with water, and you go again and you clean them. I don't really like the floss on a stick. That's a personal thing. It doesn't really clean much. If you want to use the floss, the string, that's very good. If you want to use a water pick, you're going to put it on low, but I still would like you to use the floss with it. A water pick alone is not enough. Okay, a lot of patients, they think it's not enough. Okay, I think that we spoke a lot today about the dental veneers, and I showed you like a step by step how we do them, how we put them, how it's very important to select, a dentist who really know what they're doing, because you don't want to have those sharp teeth and you don't want to end up losing your teeth, obviously. And we are in our office in Princeton, Blanche Dental. If you need a second opinion or if you need a consultation, we are here to help. And I'm going to put the contacts in the show notes, and make sure if you care for your teeth, they will take care of you. And keep smiling with Dr. Saad. Have a good one, everybody.